Well, hello, I'm Jennifer Blomquist, and welcome to HealthLine this Tuesday evening. I'm so glad you joined us. I know we have a lot of regulars. We love you. You come back every week, which is great. So you know the drill. You know that we're live in the studio, and we love it when you call in with questions. We also have the ability now to have you text in questions. A lot of people have been doing that the last couple months since we started doing that. So let me just kind of break it down for you. We're live here in the studio. We have a guest that many of you will recognize her. She's been here many times over the years, and love to have her back tonight. So if you want to call in, you can ask your question live during the show. I really like that because then our doctor, our guest, can communicate with you. I mean, she might want to ask you some questions so she can give you a better answer. So that's your first option. Second option is you can call in and just talk to the call screener and relay the question to them, and they'll let me know that, and we'll get it answered that way. So here's the deal with the texting. This is totally private. We will not show your phone number, so don't have any worries about that. But if you feel comfortable, it's great if you can maybe give us your name, where you're calling from, and then we'll just put your question on the screen and we'll get it answered. The phone numbers are a little different, so if you want to call in, it's 969-2720. If you want to call or text us, it's 969-2730. And we keep those numbers up for you at the bottom of the screen throughout the show. So let's go ahead and introduce you to our guest, a familiar face for many of our longtime fans. So Dr. Michele Helfgott, so nice for you to come back.
Yeah, it's great to be here. Thank you.
One of my first shows I did here 18 years ago was with you. Yeah. We were talking about hormones, which is what we're going to talk about tonight.
Yeah.
So for those of you who may not be familiar with Dr. Helfgott, you had a background in OBGYN for many years, and then you ended up, now you specialize in integrative medicine.
Correct.
Which I'm sure a lot of women like, it's more of a natural way to resolve problems. I don't know if you want to talk briefly about what integrative medicine is. It's a relatively new specialty, so.
Yeah, so integrative medicine is just an awesome way to look at the whole patient and really try and figure out what's going on, look at nutrition. We look at the pillars of health, so sleep, nutrition, activity. And then we try and put it all together to give you the lifestyle and to give you a healthy lifestyle that you can continue, something that you can be consistent with. And so we see a variety of people, men, women, children, all ages. And some people come because they want longevity. Some people come because they just want to be healthy and they want to know what they should do. Some people come because they have chronic fatigue, chronic pain. Some people want their hormones checked, thyroid checked. So it's a nice potpourri of things that we do.
And it's much more geared toward doing things, homeopathic,
not
homeopathically, but
not so much homeopathic,
medicine,
but yes, more, again, lifestyle changes, not necessarily medications for everything. I mean, if you need medicines, you need to take them. So let's be clear about that. But more so, again, lifestyle's really huge. Diet is huge. Exercise, sleep, managing your stress is huge. And we'll do supplementation. And again, it's integrative. So we're doing it with your family doc. We're doing it with the other specialties and really just trying to come together in a collaborative way.
All right. I just want to make sure everybody understands, because we'll be talking about integrative medicine here. But the issue you wanted to focus on tonight, Doctor, was perimenopause versus menopause, which in our culture, I think a lot of people don't take it seriously. It's kind of been joked about, and I can tell you over the years, I've met a lot of women that it's very sad. Some of the some of the ways that this, which is supposed to be a natural transition, but it can very negatively impact their life and that of their family. So it's something that should be addressed and not joked about.
Yeah. So I wanted to come tonight to let women know, as well as their partners, know that, like Jennifer said, perimenopause, menopause is definitely a transition that women go through, and it can be very difficult, but I'm hoping that if we educate women and their partners about what's going on, and you know what to look for, and you have options of what you can do to help you make you feel better, and to let you know you're not alone. So this is something normal that you go through. A lot of women will say hot flashes, night sweats, trouble sleeping. You think you're the only one who has that. And what I want women to know is the majority of you have mood changes, irregular periods, can't sleep, sweating when everybody else is freezing, night sweats, you can't sleep, you just want to put your head in the freezer because you're just so hot. This is a normal transition, unfortunately. And again, it is extremely common. The rare woman will not have those things. So the majority will have those things, the minority will not. And the difference between perimenopause and menopause is perimenopause, you're still having periods. They may be irregular in that you skip a month, you skip 2 months, you may have a period for 2 weeks long. I hope that's not the case. And menopause, and you have all these symptoms, and menopause is no period for a year. So no spotting, no bleeding, nothing for a full year, and you have these symptoms. Perimenopause can start, we're now seeing it earlier.
That's what I've heard.
Yeah.
Like early 40s even.
Yes.
Yeah.
It
that's
used
shocked
to be
me.
45, average age of menopause is 52. But even for some women, we're seeing these mood changes, these irregular periods in their 30s.
Wow, okay.
So again, I think it's really important that you know, oh wait, this is what I'm going through, but there are things you can do. You don't have to suffer. So again, nutrition is a huge part of it. For a lot of women, drinking wine, eating sugar, eating simple carbs will make those hot flashes and night sweats worse. They may make your moods worse. They may make your sleep worse. So again, cutting back on those, eating healthier foods is often something that's helpful. And then exercise is really important for that as well. Same thing with managing stress. And so trying to figure out what is going to work for you and your family is, I think, really important. And then supplements or medications, hormones, are definitely options for people. So
You've
again,
always advocated for that, because a lot of people we've talked about in the past, they're a little nervous or hesitant to go down that path.
Correct. Like I really want to emphasize, please don't suffer. You shouldn't have to. Again, make those changes, manage your stress, eat healthy, exercise. But if those things aren't working, then yes, there are supplements that may work, but hormones are definitely something that can help you. And I know for years, because of this study that came out in 2002, the Women's Health Initiative, it was a big scare for women, telling women that there was increased, the study actually was done on women who were 65 and older, whereas not the average age of menopause, 52.
Yeah.
And so we saw an increase in stroke, we saw an increase in heart attacks, we saw a potential increase in breast cancer, and sure enough, that scared everybody, which rightly so. And so we told women, physicians told women, you need to get off hormones. Well, fast forward 22 years later, we're now finding out that because the study was done on older women, the risks were different.
Sure. Yeah.
And we're now seeing that taking hormones, and hormones, when I refer to that, I mean estrogen, progesterone, for some of you, testosterone. Yes, you want your thyroid managed, you want it to be stable, but the hormones I'm talking about are estrogen, progesterone, and for some of you, testosterone, really can help you. And especially within the 10 years of menopause, so after your last period, within that 10 years, taking hormones have huge benefits for your heart, your brain, and for your bones. And I would say that's great, but don't forget you still have a brain, bone, and heart that you want to protect after that. So I think it's important to consider hormones after that as well.
Is that normally, would you say, menopause, is it considered maybe lasting 10 years, or is that average?
Great question. So Menopause is a continuum. That's the other thing. So thank you for that. A lot of women think that they go through menopause, like you're going to go through it and it's going to be over with.
Yeah.
Unfortunately, I'm sorry to say that, again, the majority continue to have the hot flashes, the night sweats. I didn't even mention vaginal dryness, painful intercourse, sleep disturbance, even 10 years past when they are done with their period. So menopause is not, a lot of times you'll hear postmenopausal. Yes. It's not.
That's
it's
not really
a
true.
continuum. You're going to continue through it. And that's why it's really important to take care of yourself in your 30s. I'd like to advocate to all our teens out there even to really good nutrition, exercise, etc., so that perimenopause and menopause is easier for you. You still are going to have symptoms, but it's easier for you. But yes, you are not done with those things, unfortunately. And women are living longer. And so we really need to protect our bones, our heart, and our brain. And hormones can help you do that. So I really want women to understand the benefits. Yes, there are risks, and there's all different kinds of hormones. There's oral, there's cream, there's patches, there's suppositories that you can put inside the vagina. There's cream you can use for vaginal dryness. Topical hormones, more like the patch, the creams, they don't go through the liver, they bypass the liver. So risks for clotting that you see with oral are less, if any, with the patch as well as with the creams.
And I assume it's not a cookie cutter
Correct.
type of prescription. I mean, you probably have to, make it specific per patient.
We really try to make it specific for patients because you all are different. Your symptoms are different, your makeups are different, how much you need is different. So really important that you get your hormones tested. We typically do it through blood. There's other options, saliva and urine, but typically you do it through blood. It's good to get a baseline. Once you take hormones, it's good for you to get checked on the hormones. Are you reaching the goal that we need you to get for you to protect your bones and your brain and your heart?
Well, Dr. Helfgott is sharing a wealth of information with us tonight, and I'd hate for you to miss out on getting a question answered. I'm sure there are a lot of women out there who, or maybe it's them or a loved one, that is having some issues with menopause or perimenopause, contemplating hormone use. This is your place to get free advice. I'm not kidding. Even the phone call is free, because if you're outside of Fort Wayne, it's still a free call. So let me just remind you, we've got the phone numbers at the bottom of the screen. Again, if you want to call, it's 969-2720. It is a free call if you're outside of Fort Wayne. Just put an 866 in front of there. And the texting has been really popular, and that's a really quick and easy way to get your question answered. The number's a little different, 969-2730. Unfortunately, we only have our friend here for another 10, 12 minutes or so. So please call sooner or text sooner rather than later. So
one other thing I do want to say is for women, years ago, we didn't recommend hormones for women in perimenopause because they were still having periods. And we were concerned that it would affect their periods and cause issues that way. And I just want women to know who are in perimenopause having symptoms that you can use hormones. And we can work around the periods, and typically it's estrogen, progesterone, again, some for testosterone, and that's good. And I think the new studies that have come out have really, it's been a blessing and a liberation for women, because women have really suffered for a long time because of this WHI study that came out in 2002. And now it's the fact that we know there are benefits. We knew there were benefits all along. We did. It just was because of the increased risks that we saw with this study. And then they put a black box warning on the hormones, and that recently has been taken off, which is great. That was done in 2024. It's been taken off. And that, again, is just reassurance that hormones are good for you. And if you need them, consider taking them. Well, should I take them if I'm not having symptoms? Well, if you have a bone density test, which women should get at age 50, and you have loss of bone, then progesterone, estrogen, and testosterone are great ways to support the bone.
Now, are these, when you talk about hormone replacement therapy, I know everybody's busy, and so, you know, is this something you do daily? I know you said there are different options, whether it's topical or, is there even an infusion? Is that in... I know there is for osteoporosis.
There is.
But I didn't know for hormone replacement therapy.
Not an injection per se, or
no infusion. So like the other things, is that make it part of your daily routine?
So like the patch is twice a week. You change it twice a week. The progesterone, if you take oral or use a cream, it's nightly. Vaginal creams are a few times a week. So for the most part, we try and make it convenient.
Yeah.
But yes, for the most part, it's something that you need to take or apply, for the most part, every night.
Well, and if you're suffering, I mean, you don't mind doing it. You know, it's almost like when you've got strep throat and you know, at the beginning of the 10-day, you know, antibiotic, you get every dose in, and then it's like toward the end when you're starting to feel better, then you forget or you're not as concerned about it. But if you're having the symptoms, I would think, you know, people would be on top of that.
Yeah, and that's why the patch and the oral patch, which is the estrogen, and then the oral progesterone is the easiest for women, because you just put the patch on, like I said, twice a week you change it, and then the oral progesterone you take at night. But yes, you do need to remember to take it at night.
For sure.
So.
Do you find that it tends to be genetic, you know, because hopefully people are talking to their moms or aunts or grandmas to see maybe what their experiences were, especially to prepare. So do you find that, is there any correlation with genetics? Like if your mom had a really difficult time transitioning?
Be. For sure, the age that your mom was menopausal typically is when you will go through menopause. That for sure. And yes, I do see a correlation. I wouldn't say it's every person, but a good majority, if they have a hard time through perimenopause and menopause, then you can. Again, very rarely do people breeze through menopause.
Well, and I was going to say, it was interesting. We had 3 women come last fall that were in, gynecologic oncology.
Yes, I saw that.
Yeah, and that was really interesting because one of the doctors after the show said she had a patient come in who was 80, in her early 80s, and she was asking her, when did you start going through menopause? She's like, well, I don't think I ever did because I'm still having cycles. The cycles never stopped. And she thought that was perfectly normal. Yes. She, you know, because that it had been, she said, well, that's just how it is in my family. But the doctor said, no, that's not normal. So that's something, again, yeah, she didn't even think twice about it.
Yeah, that's another great point. I'm 62, so we didn't talk about it.
I'm not far behind you.
We didn't talk a lot about it,
yeah.
But nowadays, hopefully, moms are talking to their daughters about what's going on and giving them some ideas of, hey, this is when I stopped my period, this is what I went through, and just help them with that. And I don't know if they're educating them in school about some of this as well. I don't know.
I mean, I have children in school, and not that I know of. I mean, there's it's really different than, you know, even when we were growing up, I feel like it was kind of an abbreviated subject. But now, you know, that I feel like my children, you have the option to opt out of any type of reproductive, that's at least, you know, I don't know if that's statewide or just in our area, but every year when I'm registering my children, it's like, do you, will you give us permission to cover reproductive health, or do you opt out of it? Yeah. Because I think some families still feel more comfortable. But yeah, they don't cover things like this. They do, I think they cover a lot of the things like, no vaping and drinking and substance abuse, things like that. But not for women's health. It's pretty abbreviated, has been our experience. So. If you do go the route of using hormones, is that something that you would expect having to change what you're taking as years go by? And how do you, would your symptoms maybe, at some point maybe you're using a cream or the patch, and then you feel like after a few years it's not giving you the relief that it once did? Is that what can happen?
It can happen. Usually not the case. Usually the hot flashes, the night sweats, the vaginal dryness improve.
Okay.
They don't totally go away, but they definitely improve. So we're constantly monitoring and constantly adjusting to help with the bones, because that's what we can measure. We do a bone density. You should have a bone density, I should say, every 2 to 3 years, depending on your insurance. So we're constantly adjusting, and some women, the patch can cause irritation, or they don't want to put the cream on. They forget. They get into bed and they forget and they don't want to, or they put it on during the day and they just got busy and they forgot. So we're constantly changing. New things are coming out. So we're constantly trying new things too, just to really make it so that it's convenient for you, easy for you, so lifestyle doesn't get in the way.
Sure. Well, they just showed me the card that we are 5 minutes out. So that's still enough time, though, to squeeze in questions. So please don't hesitate. It only takes a second to, I know all of you out there can text pretty fast. I'm probably the slowest texter there is. But if you want to quickly shoot us a text message or call us, again, the phone numbers are at the bottom of your screen. Please do so. We just have a few minutes left, but I'd love to hear from you. So one thing I wanted to ask you to just acknowledge, I guess, is I think a lot of women feel guilty because they have a lot on their plate, and especially when you're talking about, you know, some of these issues impacting women who are younger in their 30s. They're probably having younger children at that point, and I can tell you from being a mom of 6, it is overwhelming raising children today. I cannot even begin to tell you what our mornings are like. I mean, it's you know, it used to be I just took a bag and a pencil case, you know, and my sack lunch, and now it's, do you have your electronics? Do you know, is your phone turned off? Do you have your water bottle? Do you have this? It's overwhelming, and they're probably thinking, you know what, I just don't have time for myself. I just don't have, you know, and you put up with a lot, maybe of discomfort.
You do,
which can make people miserable too.
Yes, yes, it can. And again, it's easier said than done, but you shouldn't put up with it. And again, I just really want you all to know that it's not something, it's common, but common doesn't mean that it's normal and that you should have to live with it.
Yeah.
So
it's just like on the airplane when they say, you know, you put your mask on first before you help the person next to you.
Yes.
I mean, if you're no good, what are you going to do for the person you care about next to you? So
yes.
Well, Dr. Helfgott, we did get a texter.
Oh,
Yay,
good.
thank you so much.
Thank you.
Okay, so this caller is saying, I am 70 years old and wanted to know if menopause can cause bladder discomfort.
Yes. Yes.
I guess I never thought about that.
Yes, so for women as we
due to dryness.
Due to dryness, that's okay. So yes, as we get older, the vagina becomes extremely dry, and that can lead to more urinary tract infections, more vaginal infections, even if you're not sexually active, and it can cause bladder discomfort. And so we often will give estrogen cream for women to use over the urethra where the urine comes out, and then inside the opening of the vagina and on the outside. And that's a cream that we start off using several times a week, and then we'll decrease to the amount that's really good for you. But yes, definitely, that is something that can happen. And again, it can happen when you're 50, it can happen when you're 60, it can happen when you're 80. So there are definitely options. That's something that you can talk to your family doc about. You don't necessarily, depending on the family doc, you don't necessarily have to see a specialist, which would be a urologist. Or if you have a gynecologist, that's somebody else you can talk to about that, and they can prescribe the cream as well.
And UTIs are I didn't realize how serious those can be for an older person too.
Yes,
I mean they can
get into your blood and cause sepsis. And
yes. And that happened to my father-in-law, and so you just have to think about your body differently when you're older. I am learning that myself, but you
Yeah,
know,
me too.
yeah. So, well, we are only down to about 30 seconds, so we're going to have to wrap up the show. But such wonderful information,
Thank you.
and like Dr. Helfgott has said, you know, don't be afraid to look into the hormone therapy, and don't try and navigate it yourself. I would say,
no,
talk to somebody who knows what they're doing.
Don't use ChatGPT for
Yeah,
this.
yeah.
That's, you can learn about it. There's definitely lots of articles out there that you can read. Barbara Levy is an OBGYN physician who wrote an awesome summary in 2024. If you just look up her name, it's a great article for you to read. In fact, she talks about this bladder discomfort a lot. So that's a great book. Estrogen Matters is a great book. There's lots out there, so definitely look into it, but then come prepared and talk to your GYN, PCP.
All right, great advice.
Thank you.
Dr. Michele Helfgott, come back
Thank
soon.
you.
We
I
love when
will.
you come on. I'm Jennifer Blomquist. Take care, everybody. Have a great night, and we'll see you back here next week. Bye-bye.
The preceding program on PBS Fort Wayne is made possible in part by...
You gotta find your people.
Good morning.
The ones that make you feel whole.
Good. How you feeling?
You look so pretty today.
Bring it together, you got nothing to lose.
Good job.
In a world full of strangers, you don't know who to trust. You can't go it alone. Everybody needs help.
Go.
You gotta find your people, then you'll find yourself.